always tell my patients, stress plays a very, very high role in the fertility.
Oh.
There are people who have adopted children and then got pregnant.
If you are doing 3 to 4 IVFs on your body, it will not have a long-term negative effect
And
in any manner.
it all depends upon how's the couple's attitude. Sex education is very, very important.
Okay.
In Germany, it's very good. It's legally mandatory. It starts right at the primary school.
Yeah.
And when we start sensitizing them right from the beginning, especially respect in relationship, all these things, I think many of the rapes also should come.
Welcome back to GameRoom. Today we have Dr. Vanita with us. Thanks a lot, Dr. Vanita, for coming out, taking out time and being with us today.
My pleasure that you have invited me here.
So Dr. Vanita is a gynecologist. So Dr. Vanita, I'll just let you introduce yourself in terms of what have you done and what you're doing currently, and then maybe we'll take it from there.
I'm a practicing gynecologist, and I used to work at GS Medical College and KEM Hospital. I started as a lecturer, and then when I took a VRS, I was a professor. So almost 21 years I was in a municipal or a government hospital. After that, I shifted to a corporate. Right now, I'm working as a full-time consultant at H Hiranandani Hospital, which is a private hospital.
Okay. How long have you been with Hiranandani now?
It will be almost 20 years now.
Oh wow.
So 21 there and 20 now here.
So 41 years you've been practicing, gynecology. Right? Yeah. So I would love to understand a little bit more about you, Dr. Vanita. So where do you come from? I mean, are you born, brought up in Bombay itself?
I'm a born, brought up, everything Bombay girl.
Okay. And your parents were, how about your parents? What did they do?
My mother was a homemaker.
Okay.
My father used to work for a Gammon India Limited.
Okay, all right.
And we were 4 sisters.
Oh.
So actually it was not that I wanted to become a doctor or something, but I was not against it also. My father wanted one of the daughters to become doctor. So since other 3 didn't, and I had good marks, I went in medicine.
So you are the eldest or?
I'm the youngest.
Oh, you are the youngest.
The other 3 didn't. That's why.
Okay. वो लोग क्या कर रहे हैं?
The one was a teacher.
अच्छा.
The other 2 were working in airlines.
अच्छा. Okay, great. So I mean, I always, so whenever I meet doctors, I have a very high level of respect for them because, doctors have to study so much before, they actually start earning or
settling.
Start settling. So how were those initial period when you were studying for medical and then till the time you became a qualified doctor?
It was like first your undergraduate, it's mainly the studies and the little clinical exposure. Once you start your post-graduation, it's mainly the clinical exposure. After that, I went into a full-time. So, like as I said, almost for 21, 22 years, I was in a full-time. So, once you are in a full-time, you have fixed income, fixed job and all that.
Acha. So, it's a salaried concept, kinds. Okay, great. So you have seen both the municipal side where you see different kind of patients, and I'm sure in a private kind of setting you see very different kind of patients by now. So where does a gynecologist work start and where does it end? I mean, if for a layman, if they have to understand that, so let's say if I want to have a kid, right? By when should I come to a gynecologist? And मतलब gynecologist, so for example, बच्चा हो जाने के बाद, does the gynecologist work end there or so what all?
No, gynecologist work doesn't, from the patient point of view, it never ends.
Okay.
You want kid, that's why you want to come. You cannot conceive, then also you will come.
Yeah.
You are pregnant, that will come. You don't want that pregnancy, you want to terminate, then also you will come.
Acha.
You got lot of bleeding, that's why you come. You're not getting periods, that's why. So the gynecologist will continue as it's I think the extended way of a family physician, right from the beginning.
Okay,
right?
okay.
Yeah.
So in 41 years of your practice, how many patients you would have seen approximately? I mean,
many, no,
thousands or lakhs of...
Many.
Acha,
Yeah. Over there, in when I was in KM, the volume was quite a bit, and I wouldn't know every patient by name or something. Here, of course, the volume is less, and you are the person who's in charge.
Yeah.
There, since I was professor, I will have at least associate professor or lecturer and the residents below. So, if you ask, I have seen plenty.
Sure.
But I mean, you can't say a number.
Yeah. Okay. Yeah. How has the times changed though? I mean, earlier, so whenever you saw a patient, I mean, what kind, has the issues for which the patient come to you, has that changed or evolved over time, or has it remained the same approximately?
No, I think it's definitely changed, and especially if I have to compare from municipality to the private, yes.
Okay.
Definitely, because see, that caters to a different strata of patient. This caters to a little affluent class.
Yes.
Now, over here also, because obesity is coming as a epidemic, the types of diseases, gynecological disease which we see are changing. Okay. Few more things like earlier it was said fibroids will occur only those who have not conceived and all. That has changed. We see a lot of fibroids, endometriosis, a lot. Somehow, whether it's a lifestyle change, whether it is delay in getting married or conception, but somehow these things have been increasing.
Okay.
One more thing which is different from municipality to here is, here everyone is a Google doctor. They will read and then come.
Yeah.
I have no problem, they should.
Yeah.
But they should come and discuss with their doctor. Otherwise, you know, Google will tell all 100 complications, and then you start thinking, oh, have I got this? Come and discuss with your doctor what is relevant to your particular condition.
Okay, understood. Why is this happening, doctor? So, for example, earlier what used to happen is that, for example, my mom, I mean, women used to get pregnant marry very early, get pregnant very early, and then I believe that the marriage age of women itself is changing, and then, I mean, and obviously because of that, whether they want to have a kid or not, when to have a kid, etc., is also changing. So, is this a natural evolution, or I mean, or there is a certain I mean, perception around the society? Because I believe that now what I am also seeing is that now women are also open to marrying early again. So that cycle is repeating itself again. So what is your hypothesis?
I think in between, when the age of marriage was going ahead, it's because the women are getting educated, they are holding a good post, and there, come what may, it may not be apparent, but there can be a subtle differentiation between a male and a female, because if she's going to get married, she's going to get child, then she's going on maternity leave. So when it comes to the upper, so because of the career, this age increasing in the age of marriage or getting conceiving, all that is increasing. At least I haven't seen so much that the age of marriage coming down, not so much in my practice. They usually around 30ish,
okay,
28, 30, they are getting married. More, means I'm not saying everyone, but at least 80%. Okay. And conception anywhere between 30 to 35.
Okay. So, I mean, being a doctor, generally it is said that, so usually we hear people say that if a woman has to bear a child or thinking about, I mean, conceiving, they should do it before the age of 30. After the age of 30, it starts becoming a little more complicated. How much truth is there?
It doesn't get complicated, but as the age advances, fertility does go down. See, I have seen couples who have been married for 7 years, 8 years, 10 years also. Some of them might have terminated the pregnancy because the typical, this is, doctor, we are mentally not prepared in spite of 7 years of marriage also.
Yeah.
But when they stop using the contraception, they want the results just the next cycle. And when that doesn't happen, they start getting stress. So those who are going to wait for, it's individual thing, because you have to balance between your career and your family.
Yeah.
So that's okay. But at the same time, they should be aware that when they stop using contraception, it may take additionally 4, 6, 8 months also. So they should mentally be prepared, it's going to take that much of time, and don't get stressed about it.
Okay. But has it got to do with age or lifestyle also? Because I've seen that.
I think it's both. Age, of course, as the age advances, fertility does go down.
Okay.
Lifestyle, yes, sedentary, long working hours, stressful work, wrong eating, means it all is, I think, interconnected.
Okay.
Because you have a very stressful job, you cannot give so much time for yourself with exercise, your eating habits are haywire, your sleeping timings are not very, so all that is interconnected.
Okay. So when a patient comes to you who's trying for a very long time and still not able to conceive, generally, how do you, so what kind of questions would you ask in order to understand where the problem lies?
See, we do first of all, you have to ask in a detail about her menstrual cycle history, whether it's regular or not. Then we do certain tests on her as well as on the male partner. This is if they are trying for some time and when they come. Otherwise, if someone comes for a preconceptional counseling, that means they are not yet trying. Yeah. We do a certain test only for a woman. Okay. And why so? Because she is going to carry the baby, so her condition has to be optimum. Plus, if she is under certain medication, if they are allowed during pregnancy or not, so those have to be changed. Okay. Suppose she is anemic, then you have to improve that. Yeah. You have to give her a folic acid, which is the only way of preventing congenital abnormalities, and ideally it should be started at least 3 months prior. And I am happy to say, earlier it must have been about 20-30% of people who will come for a preconceptional counseling. Nowadays, at least in a private, almost 80-90% of people will come for we want to start trying, what do we do? Wow. Preconceptional counseling, and which is really a good thing.
Why has this change happened?
Maybe they are more aware with the internet and all, and the peer, okay, I went to my doctor, they said folic acid is very important, you have to start taking. So probably education, more awareness because of the internet.
Okay.
Maybe.
All right.
So which is a good thing, okay, if they come.
All right.
Because then we rule out certain congenitally transmitted diseases or something. Okay. So all that can be done in a preconceptional time.
Okay, right. Understood. So let's say if I have to think about, so let's say when if I feel that now we are ready to get, pregnant together. So before even trying, it is always good to go to a gynecologist.
Definitely, okay. Because the investigations have to be done. Certain correctable things, like if she's very obese, we have to tell her start losing weight, but at the same time you can start trying same time, because I have seen many people, they'll say no, we'll lose weight and then we'll start. It never happens. And you can do both the things simultaneously. There are many misconceptions that people feel, oh, what in this cycle I have conceived, can I do my exercise in the latter half of the cycle? Of course you can do, because you can do all your exercises throughout the pregnancy. Okay. So there is no, so all that we can explain to them when they come earlier. So one is investigation, second is corrections if required, like a obesity or anemia, or then if there is any change in the medicines if they are taking, and lastly supplementation. So all that can be done. Then of course you have to, most of the people are aware what is fertile period, but some of them may not be aware. So you have to tell them what is fertile period. Yeah. So all that can be explained in the preconceptional time.
Okay, understood. So let's say, during that preconception, how is this anemia, or how do these factors become a blockage for a person to get pregnant?
No. See, if it doesn't get a blockage,
it reduces the chance.
No. See, suppose her hemoglobin is only 7.
Okay.
And it will not be a blockage for her to get pregnant. She'll get pregnant. In our medical books it said, fetus is a perfect parasite. It takes away from mother. If she starts her pregnancy with anemia and baby is going to take, she is going to become more and more anemic. So then her condition is not optimum to carry the pregnancy. It's not a blockage, or it's not because she is anemic she cannot get pregnant. Same thing even with obesity. She can get pregnant, but when you start with a certain BMI, and if it's very high, the chances of developing gestational diabetes, gestational hypertension are high, other complications are high, cesarean section rate increases, so all these things. So these are not hindrance for getting pregnant, but as far as possible one should get pregnant when your condition is optimal.
Okay, understood. I've also seen, doctor, that there are a lot of people who don't have a very optimal lifestyle, and there are certain set of people who have a very, very good lifestyle. I mean, somebody who's working out, somebody who's doing everything, eating right, not in a very stressful job, but at the same time there is somebody who's obese and have drinking, or for that matter smoking problems as well, and yet you see people with same age with these two opposite ends, yet you see the person who's fit struggling to get pregnant, and the person who's obese gets pregnant just like that. Yeah. What happens?
That is really unexplained. Like patients with infertility, they might have gone to 4 or 5 doctors, they might come to me as a 6th or a 7th doctor, same treatment given, get pregnant, that's their luck and my luck.
So there is no scientific...
No. Okay. But if they are obese and if it's affecting their cycle, then it can be like a PCOS or something that can be a cause of infertility. But same regular cycle, semen analysis normal, everything normal, and then if it is not happening, it's called as an unexplained infertility, which really you cannot explain why it occurs.
Okay. Because when we were trying, I mean me and my wife, so we both have a very healthy lifestyle. Similarly, I was speaking with a colleague, both husband and wife drink and smoke, etc. And and I asked him, he told me that the first time when we became parent, it was an accidental pregnancy, because we went to a party. After that, whatever happened, and then
somehow, I always tell my patients, stress plays a very, very high role in the fertility.
Oh, is it? Okay.
Because there are patients who have done IVF, failed, given up everything, and then they have got pregnant.
Wow.
I know an N number of patients who have got pregnant with IVF, delivered, and within 6 months they have come with the next pregnancy. Oh. There are people who have adopted children and then got pregnant. See, once your mind is taken away from that, somehow it happens.
Yeah. So my mom tells me that, so for example, we adopted 2 kids as well. And we are now early 40s, both me and my wife. And my mom somewhere, she gives a very random explanation that now that you guys have become parents, that माँ की भावना आ गई है दिमाग में, तो फिर देखना अगर तुम लोगों ने इतना ट्राई किया था, but because that वो माँ की भावना अब अंदर है, now you would never know, but you might get pregnant
but that's true,
naturally.
That's true, as I said, no, people have adopted children and then got pregnant.
Wow, okay, all right. And then there is no explanation in terms of why this happens.
No.
Okay, all right. So now I want to get into this whole, fertility thing, which, so for example, let's say if somebody is not able to, in our office as well, there are so many people who are trying IUI, IVFs and everything else.
See, one of the things why this is, as I said, as we were talking, age of marriage, age of conception. Second thing is, what I have seen is, both the partners working, stressful jobs, traveling. It becomes difficult. Sometimes they are at long distance. Someone is in Delhi, a wife is in Bombay.
Yeah.
So to cover that fertile period becomes so stressful, because either one of them has to travel there, and then it causes stress.
Yeah.
Not only that, sometimes people find it difficult to perform when it is under compulsion. So all these things do happen.
Achha, okay.
So then naturally, then the biological clock is running down. So then you have to go to the next step, or may go to the IVF or something. So I think when they get married, or rather even before getting married, 2 of them should sit down and think, what do we want to do? Are we going to have immediately? If not, after what time? And then what my advice is you take at least 6-8 months more. That much of period may take, so don't get stressed about it.
Achha.
And then someone who really wants to do career, and if a woman, she doesn't want to have a child till say to 37, 38, there is an option now of egg or a embryo freezing.
Yeah.
The advantage of it is you're freezing your egg at an earlier age, so that gamete is a young gamete. Because as the aging occurs, the gametes also age. And then the chromosomal abnormalities like Down syndrome and all the slightly increase incidence. So if someone is 100% sure that I want family, but I definitely don't want to get pregnant before 37, 38, because I know of a lawyer, she said, no, I will do, and once I become a partner in that, then I will get pregnant. And then these are the options which are available.
Yeah. So let's say, for how long do you advise your patients to keep trying naturally? Because
depends upon age of the patient, how long they have been married. Usually, I tell them 3 to 6 months after cover, and provided all the investigations are normal.
Yeah.
Because see, once you start getting into this investigation, like ovulation induction, follicular study, if someone doesn't know what is follicular study is, it's a serial sonography where they have to come at least 4, 5, 6 times in one cycle. So that also causes a stress. If that woman is working, how many times is she going to take a concession?
Correct.
Nowadays people do have work from home and all, so probably it's little better.
Yeah.
But otherwise, if she has to take a concession, no, I have to go to doctor, and in a 1 month 5, 6 times, that causes a lot of stress.
Yeah.
So I usually tell them, try on your own, both of you are normal, all your investigations are normal, try for at least 3 to 6 months. If it doesn't happen, the threshold may be slightly low if they are already more than 35, 37 or something.
So it depends.
And again, it will depend upon how keen they are. Like they will say that I am in Bombay, he's in Delhi. So then probably you will go to the next step little earlier.
Does that also make a difference? How keen, or for that matter, how desperately you want to have a kid versus somebody who's okay having a kid or not? Does this play in your mind?
That plays.
Okay.
I know of a friend who used to run with me. She was 38, 39, and there's some value AMH what we do, which tells us about the ovarian reserve. Hers came as very low.
Okay.
She said, forget it's low, I'm not going to. So I told her, shall I refer you to our fertility department for further treatment, IVF and all? She said, no, I'm not interested in doing that, let it be. And AMH was really low. 3 months, got pregnant, came, delivered normally.
Okay.
So I think that if you are concentrating towards it, that somehow how it plays, no one knows. But it really plays a major role.
But it plays positively or negatively? So somebody who's desperately trying, somebody who's not trying at all.
Not trying at all will conceive early.
Exactly. Because it is that pressure which you are taking, right? Understood. So usually people have this misconception that, that external, so the moment there has to be an external interference in the form of IUI or for that matter IVF, in terms of which plays with your hormones and helps you get pregnant faster, it has long-term implications, negative implications on a woman's body.
No, it doesn't. Like 2-3 cycles of ovulation induction, or for that matter even few cycles of IVF, only during that time there's a hyperstimulation. So like more than one egg, many eggs are produced. So whatever you are going through that many injections, pain, all that thing. But that way, if you are not doing more than 3-4 cycles, it shouldn't have a long-term effect, no.
Okay.
And another thing what they feel is, once they get pregnant, what about the pregnancy, what about the child? Once you get pregnant, it's like any other normal pregnancy.
Oh, is it?
Yeah, it's like any other normal
because
pregnancy.
Because I've heard that the chances of getting twins increases.
No, that is there. Because
okay.
See, to improve the results, more than one embryos are transferred.
Yeah.
And that's why incidence of twins or a multiple pregnancy is slightly higher. But what I'm saying is, suppose if someone has conceived with twins spontaneously and someone has conceived twins with IVF, then they are same.
Okay.
Similarly, singleton pregnancy with IVF, the pregnancy per se will be same.
Sure. But so you are saying that if you are doing 3 to 4 IVFs on your body, it will not have a long-term negative effect in any manner.
It all depends upon how's the couple's attitude.
Okay.
There are times when people have done 7, 8, 9 IVFs also. Whereas there are people who will say ki, okay, 2, 3 and bus. So that also, I think the couple has to decide where to draw a line.
Sure.
Because it does take a lot of toll physically, mentally, financially.
Yeah.
And of all these 3, I think the mental toll is quite a bit.
Yeah.
It is quite a bit.
And it obviously reduces your chances further of getting.
That will have a probably somewhere, suppose if not conceive, that does have a lot of
Okay, all right. So how, so you have, you go through this whole journey when a woman is thinking about getting pregnant till the time, I mean, and that whole journey about of getting pregnant itself, and then uske baad, once they get pregnant, then also they have to conceive. How much of, how much you have seen this taking an emotional toll on a woman or a couple also? I believe that a woman does not walk this journey alone. It has to be with their husbands as well. So how much of an emotion?
You mean to say not getting pregnant or getting pregnant and then going through the pregnancy?
First not getting pregnant and
then...
That's
a lot of toll.
Okay, all right.
Yeah.
Okay.
Because till now, like mother-in-law, mother, everyone after 2-3 years of marriage, arey basu, you're planning and all that starts also.
Sure.
So that it takes toll. Once they get pregnant, I don't think there's, I mean, either they get pregnant after a prolonged infertility or once they get pregnant, there shouldn't be so much of an emotional toll.
Okay. No. But your hormones go up and down, right? I mean, so first, so once you are pregnant, then for the first 3 months, usually they are required to rest it out.
Not at all.
Oh, is it?
Yeah, that's what I tell.
Achha.
See, pregnancy, first of all, is not a disease. It's a normal physiological phenomena.
Correct.
So there are hardly any restrictions during pregnancy.
Sure.
Second thing is, I always tell my patient, every pregnancy is different. So don't compare your pregnancy with anyone else's.
Okay.
Because symptoms of early pregnancy will differ a lot. Some women will have a lot of symptoms, some women may not have a single symptom. So first of all, that comparing notes to working together, arey mere doctor ne ye diya, mujhe ye hota, is not should not be done. Then as regards the advice during pregnancy, there are hardly any restrictions for diet. But at the same time, usually there's tendency for constipation, gas formation, acidity. That's why they should have more of fiber or a roughish diet. Drink lot of water. Have small frequent meals rather than one full meal. And in case some particular food smell puts you off, avoid it completely.
Okay.
Another misconception, pregnancy meaning eating for 2 people, which is definitely not.
Yeah.
Okay. No restriction for activity.
Sure.
I've had patients who have ran marathon knowingly and unknowingly during pregnancy and nothing happens.
Oh.
Okay. And one step back about eating. Pineapple, papaya, nothing causes abortion. If it would have caused abortion, people will not come to us for abortion.
Even when you are trying it does not.
I'm sorry to say, there is no scientific this to avoid pineapple and papaya.
Yeah.
But unfortunately, maybe some medical people also say, don't eat pineapple, papaya. See, the incidence of abortion in human pregnancy of a known confirmed pregnancy is about 10%.
Okay.
Out of 10%, 9 will occur in first trimester.
Yeah, exactly.
Yeah, and most of the time, the conceptus or the fetus which is not of good quality, nature does not allow it to grow.
Oh.
So the incidence of abortion is out of 100, 9 will abort in the first trimester. That's
abortion or miscarriage?
It's same.
Acha, okay.
It's same.
Okay.
Miscarriage,
abortion is
what you
choose
No,
to.
that is medical termination of pregnancy. MTP.
Okay.
But abortion, miscarriage, all are synonymous. Otherwise,
all right.
So, that's why probably people say that, don't travel, don't do this, don't that, but it is not. If it's a healthy pregnancy, it will grow irrespective of whatever you do.
Oh.
If it's pregnancy which is not of good quality, no matter however progesterone support you give, keep a complete bed rest, it will not grow.
Okay.
So there is no restriction for activity. There is no restriction for traveling.
Sure.
People can have physical relation till the time they are comfortable.
Yeah.
Another thing they ask about sleeping position. Again, whichever position which is comfortable to them. So there are hardly any restriction. Just because they got pregnant, nothing changes.
Wow, there's so many misconceptions around this because
what happens, then you have to have some give reason, or why did I abort? Okay, maybe someone earlier started this.
Yeah. Because I've seen gynecologists who recommend.
There is no scientific this. One of my expat patients, she came and she was 6 months or something. She said, am I not supposed to eat papaya? Because my neighbor is saying you are pregnant, you should not be eating.
Yeah.
I said, no, there's nothing like that. This is all here.
Forget about after getting pregnant, people don't eat while trying also. so then
there is no scientific this reason or a reasoning for not eating papaya, pineapple.
Okay. Why are these, now that we are on the topic of miscarriages, or for that matter, I mean, I think we understand abortion as willfully doing, but let's say miscarriage. Okay. So why are these incidences of miscarriages? So so earlier, since you've been practicing for 41 years, do you think the ratio or the percentage, the chances of miscarriages are increasing, the incidence of miscarriages are increasing now, or
not really very much. Again, one of the reasons can be as the gametes age.
Yeah.
The aged gametes are not very good eggs.
Okay.
That's why.
Okay. What is gamete?
Gamete is an egg and a sperm.
Okay. All right.
Male gamete is a sperm, female gamete is a egg.
Sure. Understood.
And somehow the age of male partner really doesn't matter.
Okay.
It's only the eggs which mainly matters.
And what is the science behind having what we have also started seeing is that there are a lot of daughters which are being born now. Is that correct, or is that also misconception?
I don't think so.
Okay. All right.
No.
So that's also a misconception.
That is also.
Because whenever we see around, everybody have a lot of, I mean, instances. No, that's also not true.
No.
Okay. So how?
I think nature keeps the ratio properly.
Oh, okay.
Yeah.
Is it nature or is it chromosomes again?
I mean, nature, meaning somewhere nature will decide. No, chromosomes, yes.
Yeah.
But which Y chromosome, X chromosome, that is somehow who decides is the.
Sure.
In order to keep the balance.
Okay.
Now that you are at the daughter,
yeah.
Can I just tell some incidences?
Yeah.
When I started practice here, when a girl was born, many of them, we are very happy that we got a daughter.
Yeah.
But actually.
Yeah.
70% would have preferred.
Yeah.
Of course, that is changing now.
Yeah.
But then still, that Khandan ka chirag has not gone.
Oh, yeah. So I've seen so many third child being.
Can I tell you one incident which I really feel bad?
Yeah.
There was this lady, very well educated. Okay? First daughter, second daughter. Mother-in-law was hell bent ki male child hi chahiye. The husband was okay. Went outside because here pre-genetic, selection is not.
Correct.
Got implanted, came back, somehow aborted. Within 2 months, she came back to me again that we are going again for IVF outside.
Oh.
And by then she was reaching 40. I asked her, why don't you get out of this marriage? Because it's causing so much of and in between there were few abortions also. Toma, you are well educated, you are self-sufficient. She said, yes, I can get out. What about my daughters? They will not have father.
Oh, man.
Again she went, she got a male embryo implanted, good for her, good for the family, conceived 9 months and delivered a baby boy.
What is this male embryo thing? I mean, I thought you can't determine, right?
No, you can, no, but that is legally not allowed in India.
Yeah.
So they go abroad and they get only a male embryo implanted.
Oh.
That's a genetic selection, pre-implantation selection.
That's crazy.
But that is because the society, no?
Yeah.
And society. Ka chirag hi chahiye.
Exactly, as you rightly mentioned, I said that everybody keeps saying that they are neutral about baby girls, but I've hardly seen a third or fourth baby girl, but there are so many third or fourth baby boys after the first two kids being
but I think it is changing, as I said. What was 19-20 years back that we are happy we got a girl, which doesn't come that easily, but people are genuinely happy also. Maybe about 20-30% still, as I said, depending upon, even if husband was okay, mother-in-law was hell bent, no, chahiye hi chahiye.
How does it, does your genetic also play a role in terms of whether you are going to have a baby girl or a baby boy?
I don't think so, no.
Okay, all right. Just because you've come from a family where there have been elder boys or only boys,
I don't think
that does not play any role.
It's just the random, which nature, that is how, see, nature will always keep a balance between the sexes. It is we with predetermined, of course now the sex determination is banned, otherwise people used to get terminated with the female children, female feticide, that humans are altering the ratio.
Sure. So you mentioned that first 3 months it doesn't matter from a diet standpoint.
Yeah, because first 3 months, there can be a lot of symptoms like loss of appetite, nausea, vomiting. So we usually tell them that whatever you can eat and retain, that is good enough for you. Second thing is, first 3 months baby's requirements are absolutely negligible. So even if one is not able to eat, baby does not suffer. And I always tell them, look at the positive side of it. Your symptoms are going on well, that means your pregnancy is going on well. After that, after 3 months, of course.
But precaution wise, nothing, no precaution as such.
Any sport or activity which you are doing, which will cause abdominal muscle trauma, has to be avoided. Like if you are playing something, and especially after the second trimester, if the ball hits directly, that is not advisable. Whatever exercises they were doing before getting pregnant, they can continue to do till the time they feel comfortable. They have to listen to their body, not because someone else is doing, I will do. No. So you listen to your own body and then do. Usually it is advisable, what you were doing earlier, do that. Don't start something new during the pregnancy. Now, after 3 months are over, first trimester was only folic acid. After that, we start giving them supplementation like iron, calcium, vitamin D. There's some immunization or a vaccination also is important during pregnancy, like a influenza vaccine, tetanus, or a last one is Tdap, that is a tetanus, diphtheria and pertussis.
This is for the mother?
For the mother. But how it helps for the baby is especially influenza. See, when you give a vaccine to the mother's body will form antibodies against it, and these are passively transferred to the baby. For influenza, for first 6 months of life, baby cannot be given influenza vaccine. So during that time, these antibodies which are transferred from mother will protect the baby. So the vaccination is for mother as well as for her unborn child. Then usually after how the testing goes is around 11 to 13 weeks we test for a chromosomal abnormalities like a Down syndrome. The science has advanced so much that yes, you can predict the abnormality. There are few tests, screening tests, and if the screening tests come as a high risk, we can do the confirmatory test. So that is around 11 to 13 weeks. Around 20 weeks, we do the anomaly scan. The earlier tests were for the chromosomal abnormalities, whereas anomaly scan is for the structural abnormality. So any major malformation can be picked up at that time.
Like what?
Like open neural tube defect, or some cardiac anomaly, or some renal anomaly. And if they are really life-threatening, then one can terminate it before the, there is a particular age at which you can legally terminate. So that's why that anomaly scan is done. If it's not life-threatening, but still the parents are aware that yes, this is there. So they can consult a particular doctor, so they are prepared. or they can deliver at a place where some particular treatment will be required. So it is for the preparation. Then the third trimester is mainly for preparing for a delivery. So now is the time they have to start doing some sort of exercises, prenatal yoga. More active they are, better are their chances of normal delivery.
Sure. How important is to stay happy during this whole process?
Of course, it is important, but sometimes people come and ask, her job is very stressful, she works for 10 to 12 hours in a day. So, will it affect the baby? If you have been doing that, it is not going to affect the baby. But they can work till the time they feel comfortable in committing and working. The moment they feel they cannot cope up, they should stop working.
Yeah.
But it's not that because of unhappy something, the baby is going to get affected, no.
Sure. And Dr. Vanita, how important is natural delivery versus a C-section?
See, right from the word of Adams and Eve and all, the natural delivery.
Okay.
Of course, it has its advantages. But for some reason, if it is not possible, we have a cesarean section, and which is very safe. Nowadays, in modern obstetrics, the mode of delivery does not matter.
Oh.
It has to be a healthy mother and healthy baby.
Yeah.
There we get two types of patient. At one end, they'll come first trimester, doctor, I want a natural delivery, first trimester.
Yeah.
Okay?
Yeah.
At the other end, they'll say, doctor, I cannot bear the pain, I want to go for cesarean section.
Sure.
See, we always encourage for a natural delivery because there are too many advantages. But
like what?
It's natural, you get back into the everything, the next, your future childbearing is not compromised. Because once you have had a cesarean section, yes, you can deliver normally next time, but chances are slightly less than one who doesn't have a scarred uterus.
Okay.
People do say nowadays the cesarean section rate is increasing.
Yeah.
It's not that because doctors want to do it.
Yeah.
There are reasons. Age of conception has increased because more age, less are the chances. The obesity. As the age has increased, the gestational diabetes, hypertension, all these increase. Lack of exercises. Baby weights are increasing. And with one child norm, people usually want everything which has to be ideal.
Yeah. So beyond this, there are no other differences between having a natural versus a C-section?
If someone says, I want a C-section, I'll try to convince, I'll tell her there are safe methods of even pain relief. If she's scared of the pain relief, we can give it. But if she says, I want, I'll tell her that, see, first time is the best time to give you a trial. Next time probably no one will give you a trial and you will have to go for a planned cesarean section.
Yeah.
But if she insists, I will respect her wishes because some people are really morbidly scared of pain or that natural birth.
Sure.
Then I think we should respect their wishes.
Sure. What should be the role of husband as well as the family who is living with a pregnant woman in terms of making sure that it goes smoothly?
Just allow her to do whatever she is doing. You know, in South Indian households, many a times they used to tell to do the jhadu pocha of the whole house in the last trimester, which really helps in a normal delivery because they are sitting and they are doing. So all that, of course, the whole family has to be supportive, especially when they come towards the end. They are little fragile mentally, little bit can affect. So everyone, especially the partner, has to be supportive.
Okay.
And that brings us to the delivery.
Yeah.
Being there in the delivery room with the wife really makes a lot of difference.
Is it allowed? Or?
It is.
Okay.
It is at government hospitals, it may not be because of the volumes and the scarce. I mean, you don't have a different cubicles or something. In private hospitals, definitely. And I'll tell you one story.
Yeah.
I had a patient whose husband, after the delivery, told me, Doctor, my respect for women, for my wife, for my mother, for my aunts, for my sisters has tremendously increased after I saw what my wife went through while giving the birth.
Wow.
Which was really.
Yeah.
So I think the men should be there to see how much it takes to deliver a baby.
Yeah. And these days there are these new methods of water babies and all these things.
Water babies started in UK, but even now they don't do.
Okay.
Even we at Hiranandani, we do have these tubs where we keep them inside the tub during the labor process because it gives a good pain relief. For some, it's so good they're not ready to come out of the tub. For some, it is something.
Okay.
There are other methods of pain relief like a epidural analgesia. And I think if one wants, if the woman cannot bear, she should take it so that she is comfortable now that these things are available. But the attitude of the people accompanying changes.
Yeah.
Earlier, most like maybe 15 years back, why you want to take? Just bear it for some more time, it will happen.
Yeah.
That will be told by the husband, mother-in-law, sometimes mother also.
Yeah.
And I'm sure that husband at the first pain would have, if he was to go through it, would have asked. Till now I have come only one husband who told his wife, you cannot bear, go ahead, take analgesia. Why are you bothered about what everyone else is saying? There are good methods, safe methods of pain relief available, so one should take. This the woman has to bear is right from the painful cycles. ये तो होता ही है. और main thing is हमने भी सहन किया था. Whether it is painful menses, whether it is labor pain, whether it is problems at the time of menopause, but that is now changing because women themselves are aware and they know that yes, I can take a treatment and I can be comfortable. So if there are safe methods of taking treatment and be comfortable, why shouldn't they be?
So once the delivery is done, I mean, so tell me something, what are the, because there's postpartum depression a lot of people are talking about these days.
It's not that common. Blues can be. Depression is proper, it becomes a clinical entity.
Yeah.
But postpartum blues are quite.
Okay.
What happens is nowadays all women, they are well read. They know everything about pregnancy, they know everything about delivery, but no one has prepared them for a immediate postpartum period. Because I feel that immediate postpartum period as compared to that 9 months are cakewalk.
Okay.
Because sleepless nights, suddenly that someone is dependent on you, the whole this has come on you. Am I getting enough of milk? Is my child starving because of me? Then suddenly too much of milk, the breast congestion. So all that they are not prepared for it, and that sometimes adds to the. Plus everyone's interest in mother, including herself, has gone down. So everything revolves around that newborn baby. So she also has to be taken care of. She has to take her supplementations properly. She has to do her exercises properly, like Kegels and all. If you don't do it immediate postpartum period, there are long-term effects. Then she, till now, she was as free as her husband. Now suddenly she is homebound. So that part also has to be taken care. You can take her out for a drive for some time. You can take her away from, otherwise it's baby and her and baby and her. And she gets that probably feeling that, oh, I am tied up over here.
So do you guys also advise to tackle this postpartum depression? Do you guys advise couples or for that matter family to see a therapist?
If it is very, very obvious, yes. And suppose if there is an earlier history that yes, she has taken for an anxiety treatment or something, she may not be on a treatment now. But if there is a past history, then I prefer that they see a psychiatrist before getting pregnant, so that even the psychiatrist is aware, they are aware what things to avoid, what things to be done. Yes, and if it is obvious, yes, definitely therapy has to be taken.
Okay. We have started seeing a lot of early menopause cases these days. So what is leading to this, I mean, menopause coming to women at a much earlier stage?
It's not that early. Age of menopause will depend on family history. At whatever age the mother or elder sisters had menopause, roughly at that time. It's not that it is happening very early. No, I don't think the incidence has increased that much.
Okay, all right. But can you delay it then? I mean, can you do something as a woman? I mean, to delay?
No, you cannot do. It depends on the heredity.
Okay.
There are certain number of oocytes with which you are born.
Okay.
When the oocytes get depleted, obviously the ovarian, it's like a aging, normal aging process. We gray, the cataract occurs, like that.
Okay.
So it's a normal aging process. Only thing is, this is a transitional period in a woman's life. So, can I say something about menopause? Right from the time the girl starts menstruating, even 1 or 2 years before that, the ovaries start functioning and they produce a hormone known as estrogen. What happens at the time of menopause? The ovarian function starts going down, the estrogen production goes down, and one fine day it almost ceases. So, from that time till the time of menopause, that means for good 30-35 years, the body was used to having estrogen. Now, something to which body was used to for such a prolonged time, when you take away from it, you withdraw it, body may show symptoms. What is important is to know that not all women will have postmenopausal symptoms. Not all women will have all the symptoms, and the severity will differ.
Okay.
Now, the effects of this estrogen deprivation are short-term effects and the long-term effects. Short-term effects are in 3 groups. First is a vasomotor symptom. It comes like a sudden wave of heat followed by intense perspiration. It's called as a hot flush. Can come many times in a day, once in a week, many a times it will come at night. That's why it's also called as a night sweats.
Okay.
The second group of symptom is urogenital, because estrogen is responsible for the inner lining of the urinary tract and the vagina. Because of lack of it, this lining becomes thin. That's why dryness there, itching, frequency of urination, difficulty in keeping physical relation. And the third and the most important is psychological. Some can get depressed, some can get irritated, some can have both, and typically the husband and the children will say, till now our mother used to be very cool, now suddenly with something and she just takes off.
Yeah.
Unnecessary fear, palpitation, all these things come, and this is the time when the partner and the whole family has to be supportive, because it's a transitional time. As body was used to having estrogen for good 30-35 years, over a period of 2 to 5 years, body will get used to not having estrogen and all these symptoms subside. So, the whole family has to be supportive during that time. And for a woman herself, it has to be a little bit more of a disciplined lifestyle. Like eat at regular intervals, sleep at regular interval, some sort of a exercise every single day. Occupy yourself in something which you like some hobby or something, and then she can easily tide over this period. The main long-term effect of estrogen deprivation is osteoporosis. Estrogen is a bone building hormone. Because of lack of it, now the bone density starts coming down. And if you compare men to the women, for first 5 years the bone density starts coming down drastically, then it slows down. So, all women, ideally speaking, over the age of 40, if not definitely after the menopause or a perimenopausal, have to start taking calcium. It has to be every single day and forever.
Okay.
This is only half the treatment. Other half of the treatment is continuing your physical activity.
Okay.
Minimum 30 to 45 minutes of brisk walk will keep the bones healthy.
Super. Last few questions, doctor. So, there are women who choose not to become pregnant at all. And and there are women who become pregnant. If somebody has to come to you for an advice, in terms of body of a woman, does it change in any manner if I choose not to become pregnant ever?
Those women who have got pregnant, who have breastfed their children for a longer time, are supposed to be having less incidence of breast cancer, which again is changing. Like my mother-in-law, she had 4 children, she breastfed them 2 years, still she had.
Okay.
So things, but that is one of the supposed to be a preventing effect. Even having pregnancies, because see what happens is with every ovulation, the lining of the ovary gets disrupted. So the more number of time this disruption has occurred, so probably those who don't conceive and get pregnant, because those 9 months it is stopped, maybe slightly increase incidence of ovarian cancer or even for that uterine cancer. The benign conditions like fibroids, endometriosis also are more common in women who have not conceived. Whether it is cause or effect, really we don't know. But all these things where when we were students, they were really, they are not anymore applicable. Those who have conceived and had children, they also somehow have.
Okay. Why is surrogacy banned in India?
Because I think one can, like, why is there are such strict rules for a kidney transplant?
Yeah, okay.
People can be exploited, no?
Yeah.
So similar way.
Okay.
Surrogacy, it's not banned. Altruistic surrogacy is still continuing.
What does that mean?
That means if I have to do for my own sister or for my sister-in-law, where I'm not getting any monetary benefit, that is allowed. So similarly, kidney transplant, which is, it's only the relative can donate. Earlier, it was the poor people, they were getting exploited.
Yeah.
So similarly.
Okay.
But altruistic is allowed. And secondly, I'm not very sure, but suppose for some reason that woman cannot conceive, or rather cannot carry the pregnancy because of her medical condition, then you have to go apply to the court, take a permission, and then in that case surrogacy will be allowed.
Okay. Yeah. One important, I would want to end this conversation with this topic because maybe I should have asked it right from in the beginning itself, because that is where everything starts, which is about sex education itself, right?
I think I'm very happy that you have brought this point, because I think sex education is very important.
Sure.
Like, I had a girl whom I had housed for 1 year. She was from Germany. She was surprised to know, what? There is no sex education in India? How do they come to know? No. Do the parents tell? No. That was my reaction.
Yeah.
Then I talked with her in details in Germany, and there's a difference between European countries and even US also.
Okay.
In Germany, it's very good. It is mandatory for all schools. It's legally mandatory. Okay. What is important is they tell about everything age appropriate. It starts right at the primary school.
Yeah.
They tell about puberty, reproduction, contraception, then gender roles, emotional this in relationship, sexual diversity. So they have been sensitized right from that age, sexually transmitted diseases.
Yeah.
And there, how they have is, it's not a standalone. It's something which is incorporated in their regular curriculum.
Yeah.
Like in biology, ethics, religion, or social sciences. And because they have been sensitized right from that time, you are giving that young adolescent, you are providing. It's very important that they should learn to say no. It's not only the sex, because what happens, suppose there's a girl and in group of 5, 4 others have boyfriend, whether she wants or not, she will have to, because that peer pressure. So one, we have to tell them, learn to say no. Second is, unless and until you feel your body as well as your mind is ready, you should not go for it.
Yeah.
And third is contraception. If there are safe methods of contraception available, no one should come for a MTP. So when you educate this young adolescent, they will go for what is called as a responsible sexual behavior, which is very important. In India, we have our bodies like a Mumbai Obstetric Society or a Federation of Obstetric Gynaec and all, which more than 20-25 years we used to go and we used to tell them about puberty, growing up, mainly about menstruation, hygiene and all. But there also someone from PTA will be there, because sex education should not be given.
Yeah.
Even now, it is little better, but they are for a higher school levels, contraception, all those things. I think it has to come as a, and this was for maybe for few elite schools or something. It should be, I think, legal, mandatory that it should be there, whether it's a municipal school, whether it is a private school, it has to be there. And when we start sensitizing them right from the beginning, especially respect in relationship, all these things, I think many of the rapes also should come down.
Yeah. In fact,
it's the need of the hour. I think these all education ministers and all, they go out and all, they should go, they should study how it is done in different countries and adopt it to what is possible in our scenario, but it has to be done.
Because even till date, I mean, there are family members who have objections to what a girl should wear, what they should.
I'll give you an example. See, suppose there are the household has one daughter and one son. Okay, you go on telling the daughter, don't wear shorts. It's not good. People will look at you. You have to come home before 7 o'clock.
Yeah.
This boy is also hearing that. When he goes out, when he sees a girl who's wearing shorts, in his mind, oh, this girl is wearing shorts. That means she's not maybe a good girl. Okay, I can approach. So whatever this discrimination in the gender, this thing has to be started right from the beginning. What we talk to our children also.
Yeah. Yeah, exactly. I mean,
because otherwise it may take 20 years, 25 years, but unless this mandatory sex education and change in the societies, we have come a long way. I'm not saying that it is a lot of differentiation like earlier, like my mother's time. She had to stop her education after she was doing, she was very, very intelligent woman.
Sure.
But her education was stopped after vernacular final. It was 7th standard because the sons had to be given education. That all is stopped now. But still all this looking, they observe how the mother is treated by her father.
Yeah, exactly.
So all these things along with sex education will go a long way. It may take time, but unless we start, how will it happen?
Correct, correct. Great. Thanks a lot, Dr. Vanita. It was really, really insightful.
Pleasure is entirely mine. Even I enjoyed it. Thank you very much.
Thanks a lot.
Thank